One of the greatest challenges that I see is representation.
What do you feel like is the biggest bucket that if we at the end of this call could actually come up with solutions, what would it target?
I do some advocacy work and mentoring with the National Psoriasis Foundation. And one of the greatest complaints of a lot of patients is that there is lack of representation and understanding, and often misdiagnosis, especially with the skin conditions such as psoriasis, where it does look different than what in black skin versus white skin. When I experienced the flare-up that I experienced, it was unlike what I've ever experienced in life. And I was just trying to find anyone that could relate to what I was going through, because it's very difficult to navigate when there's not an understanding just based off of differences.
From a cultural standpoint and from a trust standpoint, it's important that we have appropriate representation across various specialties in medicine. And when that is lacking, there's automatically sort of a void and a consequence that follows that. And so that's one of the biggest barriers is really that lack of representation.
And how about you, Afshin? Did you find yourself having to advocate for yourself in a space where people didn't necessarily share your same either culture or understand when you were trying to relay what you were going through as a patient?
Yeah, definitely. I think even just when I was younger, my parents just weren't aware. As immigrants, coming in, you don't really have the access to the knowledge. So for me, it was just lack of health insurance, and that is just something that I'm continuing to find as a hurdle, because you have to work full time in order to get health insurance, but with your diseases, you often can't work full time. And that to me has become the biggest hurdle, especially in the last 2 years with COVID. Being on immunosuppressive medications, I'm not safe going back out in person.